Hello, my name is Lisa Naggington. I'm the Clinical Services Manager for the Community Drug and Alcohol Service in Stoke.
And my name's Lisa Riley and I'm the Recovery Services Manager for Community Drug and Alcohol Service in Stoke.
And here at CDAS, that we're more commonly known, we offer a bespoke Hepatitis C clinic here, and we have done for quite a few years now, very successfully offering anybody that comes through the door a dry blood spot test, which is a non-invasive procedure, and it's quite simply a finger prick test that gets put onto a card. It's 5 dots of blood. It is a little stab of your finger, and then it gets posted through the post, and you get the results back between 7 and 10 days. The results are 99% accurate, and once we get the results, if you're negative, that's really good. If you're positive, however, we are the only clinic in Stoke-on-Trent and Staffordshire that offer the treatment services here. So if you were positive, you would just come back, we tell you you're positive, and then we go through a process and you'd receive the treatment here. You wouldn't have to go to the hospital, and then we do a post-treatment blood test after to make sure that the virus had gone.
Every single person who accesses treatment and support for our services is offered the opportunity for a dry blood spot. We don't make a pre-assessment as to whether someone's had risky behaviour recently or over the previous X number of years. We offer it as it's a global offer to all of our clients, whether they're accessing treatment for alcohol or drugs. It can be normally offered on the day that they're coming in for the assessment, or at any other time when they're coming into the building. We're very flexible as to when we're able to provide the tests.
And just to give you a little bit of background about Hepatitis C and the Hepatitis C campaign, which we fully support here at CDAS, along with the Hepatitis Trust. The liver, which is situated here, just in case anybody didn't know where it was, is a fantastic machine, but because it's so fantastic, Hep C is called the silent killer, because you can have Hep C for up to 15 years without any symptoms whatsoever. It may have been when you were 18 or in your younger days that you were doing things that may have put yourself at risk. It's a blood-borne virus, so it has to be blood-to-blood transmission. Now that doesn't always mean needles and drug use. That can be cocaine use when people are using £10 notes. They use straws. If they don't cut the cocaine up finely enough, it cuts the nose. Then people share that note. And we've had quite a few positive people who've used cocaine. It's not just people who use needles. And in terms of the needles as well, many people don't share their needles. It's the paraphernalia that goes with the needles, so the spoons, the filters. When they cook up the heroin on the spoon, other people will put their needles in, and it's a straight transmission. So that's, as Lisa said, we offer it to anybody who uses drugs or puts themselves at risk. And your liver, like I say, it is a fantastic machine, and what happens over time is the cirrhosis or the death of the tissue works its way along the liver, but your liver will continue to work, and that's why people don't get symptoms. So we would encourage anybody, get tested. The treatment is fantastic. It's 12 weeks, no injections, and your virus can be gone. And as it says, you know, it's a treatable. Hep C is treatable now. The results are phenomenal. So look after your liver, get tested. If you've put yourself at risk, come and see us at CDAS. It's just a small prick of your finger, and I'll just go through that with you. Okay. Sharp scratch. We always try and make sure that we fill the circles up so it doesn't come back as inconclusive. There's 5 blood spots that we take. All that we ask is for a name and a date of birth. It's a confidential service. And it's quite painless, isn't it, Liz?
Yeah, doesn't hurt at all.
Okay. We'll leave that to dry just for a second. And then if you just press on there for me a second, and I'll pop your plaster on in a minute. And that's as easy as that.